we have announced something that we were expecting for a while now, that we have our first confirmed case of COVID-19 in Saskatchewan. And so in this instance, it was a person who had traveled from Egypt. Egypt is one of the several countries listed on the WHO website that is showing community transmission. The individual developed symptoms on March 9th after arrival in Canada, and was tested and found to be positive. That result was announced this morning. The individual is comfortable isolating at home, like the majority of cases in Canada. The individual has had very little contact with anyone else, apart from one person in the house. So public health is diligently following up with the individual, their movements while in Canada and in Saskatchewan, to see if there's any contacts that need to be informed to self-monitor themselves. And the main message for this particular instance is that the general public does not need to be concerned. Public health will contact anyone who needs to be aware. In terms of our risk assessment, we've been saying for some time now that with several cases in Canada being reported due to travel, we were expecting to see a case at some point. We will expect to see more cases in the future, primarily linked to travel, but we remain vigilant to also detect cases which may not have traveled. And this leads me to the general principles that we have been enforcing, that anyone, irrespective of travel, if they have a cough or fever, stay home. Anyone who is outside, practice good social distancing. Avoid shaking hands, cough in your sleeve, wash your hands frequently, or use a hand sanitizer. And especially if you have traveled anywhere in the world, or if you have attended a conference or a large gathering, even anywhere in Canada, when you come home, you can go about your daily business, but closely monitor yourself and your symptoms. Ideally, you can take a temperature twice a day, and at the first sign of fever or cough, self-isolate. Don't go to school, university, or work. Call Healthline to see if your symptoms need further assessment and testing, and get tested if that is the recommendation. And we hope that through this process, we will continue to quickly isolate people who have COVID-19. Many individuals will remain well enough to stay at home till they have cleared the virus, and their close contacts will similarly be asked to self-isolate for up to 2 weeks and will be monitored for symptoms. And this is what we need to maintain for as long as we can to prevent further community transmission in Saskatchewan.